Dear Chairperson of the session, delegates, uh, all, good morning to you all. I'm happy to present the paper on human resource management challenges in COVID-19 in the 8th International Seminar on Entrepreneurship and Business 2020. I'm Dr. Mangaleswaran, Senior Lecturer, Vavuniya Campus of University of Jaffna, Sri Lanka. This COVID situation, even based on my experience as a head of the institution managing the HR during the COVID, based on experience, I have taken this topic uh, for my research. The coronavirus disease, officially named as COVID-19, declared a global health emergency by World Health Organization in January 2020. It has spread all over the world. The World Health Organization declared the global pandemic since March 11, 2020. Our country also spread COVID to. Initially, Sri Lanka was locked down. Initially identified one person affected COVID for 3 months, March 2022, May 2020, that the country was locked down. Second wave of COVID-19 in Sri Lanka since October 2020. At present, uh, more than 15,000 Sri Lankan having contracted the virus. This is human resource management. Every organization practice. It's a strategic approach to effective management of the people in organization. So, they specially design this discipline maximize employee performance. So COVID is unfortunate. So how we manage the COVID using the HR. So Collins and Wood in 2019, they conducted research and defined HRM is primarily concerned with the management of people within the organization, focusing on policies and system. Here that Povey and Moon 2009, they defined what is HR department and their responsibility. It's HR people are overseeing employee benefit design, employee recruitment, training and development, performance appraisal and reward management. These are the basic activities of HR, or it's a responsibility of HR department. HRM challenges in COVID-19. It's a lockdown and unlocked a challenge during COVID, managing human resource in the organization. Especially that challenges are the business continuity plans, flexible work arrangement, and employees also wanted flexible time, managing employee communication, communicate the employees into employee concern on address on the employee concern on workplace policies. Organization look after these employees' safety, travel restriction, response committee from decision making, split working arrangement for specific function and roles, differentiate measures to boost employee welfare. We have to think about employee welfare, top protective equipment like especially mask or that facility, hand sanitizer, hand wash, family care support like flexi work staff and employee assistance program. These are I found from the studies conducted before me. These are the challenges in COVID-19. Next slide. That global COVID pandemic, mental, physical, and financial communication to the people everywhere. Now that presently organization, uh, they rely or depend on the HR department, their workforce feel as safe as possible during this unprecedented and unpredictable time. It's an organization expect HR department to look after these people and manage the even COVID using their staff. Almost 7 in 10 HR leaders cite it's a crisis management or it's a business continuity plan the top challenge during the COVID-19 outbreak. Ladies and gentlemen, it's our Sri Lankan Chartered Institute of Person Management of Sri Lanka, Mr. Namika, in 2020 through that discussion on COVID and HRM challenges. He mentioned most of the organization, the challenges are the leave matters, employee staff leave, salary or the pay issues, compensation, health and safety issues, additional employee cost, performance measurement, especially their work at home, performance measurement, social stigma, remote work facilitation, cultural challenges, moral issues, well-being of workers, moral issues, well-being of workers, he mentioned in 2020. From this study before me, I define the purpose of my study, explore the human resource management challenges during the COVID-19 in Sri Lanka. What are the challenges faced by the HR challenges faced by our HR managers. Further, this study identify the effective HRM practices to overcome the challenges for success and survival of the organization. How can we effectively manage HRM to the success and survival of the organization? The methodology for this research, I adapted quantitative and qualitative methods for collecting the data. I developed the success questionnaire. Questionnaire consists 21 questions, especially collected the respondent profile, human resource management and challenges. There are totally 220 Sri Lankan managerial level staff responded questionnaire via the Google form. Here the respondents are from different organizations, public sector, managerial staff, private sector, and non-governmental organized. They have responded for my questionnaire. I adapted descriptive statistics and content analysis to analyze the collected data. This data analysis, a respondent profile, these public sector organizations, there are 50 managerial staffs are responded, private sector 31.8%, remaining are non-governmental organizations in Sri Lanka. Here is especially I focus through my questionnaire is HR challenges, how HR practice during the COVID. Especially staff attendance. Before COVID, they responded, most of the organizations use finger. During the COVID, employees want to change from the finger to manual. It's a big challenge for a HR manager in the public sector organization and private sector. The public sector organization, even I also face as a public sector organizer, head of the institution, is demand of the employees they want to manual. But I mentioned that instead they fear that finger. I told instead of going manual, finger is not much risky. Before you finger, you use the hand sanitizer, then it won't be big issue. Then they have accepted in our organization. But in the public sector, most of the employees are wanted this manual. Then they can even come late or go early. That's the reason. Organization adopted different attendance practice due to the COVID. Even that employees request most they respond. Their managers are responded about 72.7%. They have given the flexible time to the employees. Even they can come whatever the time want, they can leave. Then rotation, employee rotation, that even 50% employee can attend, or two-third or one-third can attend the work. Then they have allowed work at home about even that curfew time. They are locked down curfew, then 90.90 per, yeah, during the time responded, they have given that time work at home. And some told the change finger to manual. They have accepted the employees request, they change. And some organization change finger to face recognition for attendance in COVID-19. The salary of the staff, even especially that many responded, they paid 80% of the respondent basic salary and allowance, especially public sector organization in Sri Lanka. Government announced without even deduct any loan borrowed, they paid the whole salary and the allowance during this period. Even that private sector, some the respondent are private, they paid only basic salary or the half salary. Public paid a salary, yeah. Healthy health environment, it is a pre-request or open the organization. It's given by the health department. Is most of the organization, the managers responded. They provided face mask, sanitizer, and maintained social distance. Health department was very strict to fulfill the basic requirement or precondition opening the organization. Second wave of even that first wave, they followed after everything. So okay, they felt that no COVID. Without follow this health department instruction, the second wave come to Sri Lanka. It's heavily affect our country. Now this government of Sri Lanka gazette the rules to be followed. A breach, they will be punished. The trade union and COVID, it is also interesting that trade unions, especially that manages about 63.6% have trade union, about 36 non-governmental organization, private sector, they don't have a trade union. Trade unions that managers responded, they also supported to management to the new normal. Trade union demand, but they demanded health and safety of the employees. Even they wanted even insurance for employees and free these face masks, and those are the requests. Even union focus on overall well-being of the organization. They supported the organization as well as employee. It's a response by the managers. Well-being of the employees, only 29% of the managers told they only look after 29% of the respond. Well-being of the organization, about 90%, I think it's less, but they focus mainly their organization and the employees. COVID and its impact on HRM, how its impact on HRM practice. Even that interesting that COVID also, they responded 50% of the respondent or the managerial organization, even positive impact also HR in the organization. They told about 40% of that managers respond. It's a negative impact. Some told no impact of the HR, especially no impact in the private sector. Negative impact also mainly public sector organization. Uh, Even through the interview, managers responded COVID impact on HR practices, especially uh, attendance of the employees. They are poor attendance, motivation, very difficult to face motivation. Recruitment and selection, they can't process. Training and development, they can't provide the training and development to the staffs initially. Now they have changed through the webinar or Zoom. Performance appraisal also challenge or the impact on the performance appraisal system, compensation, health and safety, human resource planning, socialization, career guidance, employee relations, employee behavior, etc. Changes in HRM practices to respond COVID-19. Through the COVID, what are the changes? Respond they had made changes in the HRM practices. Yeah, it's changes. COVID-19, some steps they have taken: termination of contract, employees, temporary staff, even some of them halt, stop allowances, overtime and benefits. They have stopped flexible working hours. Even they have allowed to flexible working. Implemented halt allowances and overtime and benefits. Challenges in COVID-19 in the responded. This motivation is a challenge. Very difficult to motivate the employees, engage the people, or involvement challenge. COVID fear employees dealing with inadequate resources to work at home. They can provide. They face problem to provide the laptop or internet facilities work at home. HR practices, carrying out HR practices challenge. Getting things from employees also challenge in the HR managers. Further, remote workforce challenge because they could not measure and supervise their performance. It's a work at home or remote workforce is a challenge, especially. So measurement of their performance. Respond that challenges were individually. Getting the required output is a challenge. Providing appropriate technology is a challenge for many HR managers. Workers' capacity to work remotely is very difficult. Time constraint. Even difficult in conduct and communication. The employees, these managers are very busy. Always communicate through the over the phone or internet. Difficulties work at homes. Some staff face difficulties in management, lack of infrastructure and payments of wages in time because they organize a lot of work at home. Then very difficult to even finance department pay the salaries and allowances. HRM challenges in COVID-19 is further. Employees always complaining that workload too high. Dissatisfaction in employee health, work-life balance, because they told it is a burden. They have to some less employees attendance and the flexi time is a reason. The workload too high. They fear about their peers, subordinate employees are fear about their peers, subordinate and superior because their health condition may be transmitting them. And they felt that no one look after their children at home. They are coming, then children, they don't have schools, they had no engagement. They fear that they may take COVID to their home from workplace. That was their fear. Then overcome the HRM challenges. How can this through the survey that they responded, adapting best practices to manage and well planning with give and take policy, educate employees on the situation to change, get cooperation of the staff, adhering to the policy guideline instruction issued by the health department, be flexible and new ways of working, innovative and flexible, motivation, education, staying firm on unreasonable union demands, staying firm on unreasonable union demands, innovative ideas, and cost cutting to overcome HR challenges during COVID-19. It's an open-ended question. Most of the people are responded. These are their responses. I have list out how can overcome the challenges of based on their experience, private and public sector, non-government organization, managerial people response. Summary of findings from that analysis and the survey. Attendance practice have changed in most of the organization due to the COVID. More than one method adapted for attendance. Basic salary and allowance that I already mentioned through analysis paid by the public sector or private sector, only basic salary and or some way half salary. Most of the organizations provide basic facilities, especially hand wash, sanitizer, face mask. Trade union support to management with the new normal. Trade union focus on the overall well-being of the organization. COVID make a positive impact too on HRM. Some organization changes their HRM practices. Remote workforce was a challenge for organization. Motivation, engagement, dealing with COVID peer employees, inadequate resource to work at home, HR practices, things from employee were challenge. Recommendation from this study is better adapt best practices to overcome HRM challenges in COVID-19. Management develop effective plan with give and take policy. Department conduct training or awareness program on educate the employees how to handle the COVID and health and safety. Management get cooperation of all the staff, everyone be in the support. Accommodate new ways of working, being innovative and flexible. Ensure employee safety and health. Maintaining regular communication with the staff, equitable employee policies, collect employee feedback. It's very, very important. Reward and recognize employees who are working, who are performing. Thank you very much. It's a time for discussion and the question. Any clarification you can make clarify, or if you can make clarification through email or WhatsApp or Viber. Thank you very much for organizing committee of ISCB 2020. Thank you.